What's up, EMEDI fam? Today we're coming in hot with another lecture. Today we'll be discussing stable versus unstable angina and STEMI versus NSTEMI. Now, angina is a type of chest pain caused by reduced blood flow to the heart, but there are many types. We have unstable angina, stable angina, Prinzmental angina, and many non-cardiac anginas, which we'll all discuss in much more detail. Now, unstable angina often occurs suddenly and at rest. We have a crescendo pattern where it gradually builds up with unstable angina, and it typically lasts for greater than 10 minutes. During cases of unstable angina, the troponin level is often normal. Stable angina, on the other hand, occurs during activity and resolves with rest. In this case, we will see a crescendo-decrescendo pattern in which it gradually builds up and then declines. Typically, this only lasts for 2 to 5 minutes, and once again, the troponin level is normal. Now, there's also an interesting case called Prinzmental angina. Now, Prinzmental angina occurs due to coronary artery vasospasm. Typically, this condition occurs at rest, and stress testing has limited value as pain can sometimes improve or worsen with exertion. On EKG, there is often evidence of ST elevation. However, this elevation is indistinguishable from an acute MI. But despite the symptoms and ST elevations, patients with Prinzmental angina will have a normal troponin level. Now, there are two very important anginas that you can say, are misnomers, given that they are non-cardiac related. Ludwig's angina is a rapidly swelling area of cellulitis and/or abscess involving the sublingual and submaxillary spaces. This polymicrobial infection often develops from a severe dental infection from the molar and premolar tooth root. Patients are often toxic in appearance and dehydrated. There is also a serious risk of airway obstruction and compromise. Now, CT is the diagnostic study of choice, which helps delineate the presence of abscess, and treatment includes IV antibiotics, potential incision and drainage of the neck, tracheostomy, and excision of the problem tooth. Benson's angina is another form of non-cardiac angina, which is an acute necrotizing infection of the pharynx and tonsils that causes painful ulceration, swelling, sloughing off of dead tissue from the mouth and throat. Patients may suffer from fevers, lymphadenopathy, and a metallic taste in the mouth. Benson's angina is often caused by a combination of fusiform bacilli and spirochetes. CT is also the diagnostic study of choice, which will show gas and potentially an abscess within the soft tissue. Treatment includes IV antibiotics and oftentimes surgical debridement. And then there's NSTEMI versus STEMI. During both cases, patients will present with chest pain. In the case of NSTEMI, or non-ST elevation MI, on the EKG we will merely see ST depression or T-wave inversions. Typically, NSTEMIs are subendocardial infarct involving partial wall thickness, and troponin levels are elevated. In the case of STEMI, or ST elevation MI, the EKG will see ST elevation, and the infarct involves the full wall thickness, and hence troponin levels will be elevated. Now let's bring it all together. In the case of unstable angina, this pain develops when there's increased demand in the setting of a stable atherosclerotic plaque. The vessel is unable to dilate enough to adequately allow blood flow to meet the myocardial demand. Hence, it's called demand ischemia. On the EKG, we'll see a completely normal EKG, and the troponin levels will also be normal in the cases of stable angina. In the case of unstable angina, the plaque ruptures and a thrombus forms around the ruptured plaque, causing partial occlusion of the vessel. Angina pain occurs at rest or progresses rapidly over a short period of time. Hence, it's called supply ischemia. On the EKG, we'll see a normal EKG versus inverted T waves or ST depression. But in cases of unstable angina, the troponin level is normal. During the case of NSTEMI, the plaque rupture and thrombus formation causes partial occlusion of the vessel that results in injury and infarct to the subendocardial myocardium. This is a subendocardial infarct. On EKG, we'll see either a normal EKG, inverted T waves, or ST depression. In the case of NSTEMI, however, troponin levels are elevated. And lastly, in the case of STEMI, a STEMI is characterized by complete occlusion of the blood vessel lumen, resulting in transmural injury and infarct to the myocardium, which is reflected by EKG changes and a rising troponin. This is a transmural infarct, and on EKG we'll either see the hyperacute T waves or ST elevation. And in the case of STEMI, the troponin levels will be elevated. Now, this lecture was brought to you by E.M. Eddy, a doctor's best friend.